morning, everyone, and welcome to the first ever summit by Dumontel Healthcare Consultant. And I'd like to give you a little background on our first speaker of the day, Carole. So Carole is a nurse epidemiologist, health system and infection prevention strategist, and the CEO of Dumontel Healthcare Consultant. With more than 15 years of experience across healthcare, public health, and nonprofit sectors, she helps healthcare executives and public health leaders design cost-effective, resilient systems that strengthen workforce sustainability, reduce harm, and align infection prevention with enterprise strategy. Her work has supported over 33% of infection reduction, more than 1.1 million in cost savings, and helped achieve magnet recognition for healthcare organizations. Carole leads the CBIC-approved Power IP coaching program that supports organizations through the leadership training of her early career infection preventionists. She developed IP PROPEL, a trademark system-level framework that elevates healthcare organizations by applying business principles to strengthen leadership alignment and positioning infection prevention and operational redesign as enterprise-wide strategic assets. She serves as a subject matter expert for the Policy Pro Hospital Policy and Procedures Project for Rethink. She is a contributing editor for Infection Control Today. She's also a nonprofit founder and longtime board leader, and the current interim board chairperson of Congo for Tomorrow, where she has provided nearly a decade of strategic, operational, and governance leadership. Her thought leadership spans artificial intelligence in healthcare and public health, healthcare system redesign with proven cost reduction and workflow optimization, and the evaluation of infection and the evolution, of infection prevention into a system-level leadership discipline, making her a trusted voice of healthcare executives, public health leaders, and infection prevention professionals navigating what comes next. She has appeared as a guest on multiple podcasts, including 5 Second Rule, hosted by the Association for Professionals in Infection Control and Epidemiology on Infection Control Today, and 2 podcast seasons hosted by Transmission Control. And her latest appearance on the Follow the Brand podcast, hosted by Grant McCaw, CEO of 5 Star BDM, where she shares both strategic insights in business, infection prevention, and system thinking. Carole received industry recognition as a SHE Super Advocate in 2023 for her contributions to national healthcare quality policy through volunteer leadership with the Society of Healthcare Epidemiology of America. And with that, I give you Carole.
Thank you so much, Dr. Ellis, for the introduction, and thank you everyone who was able to make it here. I know the majority of everyone who's there right now is on the West Coast, so thank you for being here at 7 o'clock in the morning. I really appreciate it. So as Dr. Ellis said, this is our very first summit, and the reason why we created the summit is really because we've received many data from healthcare and public health leaders about all the challenges we're all experiencing. So we wanted to come here as leaders and convene and discuss about these challenges and potential solutions to those. So my session, I titled it, Why Leaders Must Rethink Workforce Signal, Alignment and Systems Design. And the reason why is because much of the data we collected in the past couple of years, those were the themes that we were seeing come back: workforce complaints about burnout, fatigue, the desire to quit our job, and also a lack of alignment between leadership and what's happening on the front line, and also just how our health systems are broken in many places of the world. So what I hope you will take away today is seeing workforce pressure as intelligence, not inconvenience. So for us, sometimes as leaders, when we hear those quote unquote complaints from staff, we feel like it's just they're trying to make our day hard, but we should use that as a signal that something is not working in the system. And the second thing I'd like for us to see how a fragmented system can cause us to not reach our long-term goals. And also, we should use signals, as we like to say, looking at the forest instead of the trees to see how we can fix those burnout, turnover, quality gaps, and also operational bottlenecks within our organizations. So for me, this started since I was a little girl. So this summit was pretty much created since I was 7. I didn't know then, but it looks like it was. So I was in a pretty, I would say at the time was considered prestigious high school, not high school, elementary and high school. So a school, it was a private school when I was born in the Congo. And the school, we expected everything to go well, because when you're in a private school, you think that everything is perfect, right? But the school was part of a larger system where healthcare was fragmented and the system was weak. So what happened to me just going to this private school, prestigious school that everyone wanted to go to, one day I had a sip of water from the tap, expecting it to be clean. Then I ended up with an amoeba infection, which my mother told me I almost died of. I had serious gastrointestinal symptoms. She really thought I was going to die. I was dehydrated. I had to go to the hospital. So I did have a life-threatening illness. And from that day on, of course, at 7, I'm not thinking the health system is broken. I'm just thinking, why am I sick with this horrible disease? And as I grow up, I see on TV people dying from cholera or typhoid. And of course, living in a LMIC at the time, I was also experiencing multiple preventable infectious diseases like malaria and so on. So that's really where, as I started growing up, I saw that the health system was weak. And at the time, I decided I wanted to be part of making things better. I didn't know what that meant at the time because I was a child, but I wanted to help make things better in the long run, and decided one day I would go into public health. I would become a doctor, but I decided to go the nursing route where I learned to do hands-on care and got into public health, which has been one of the best decisions of my life. So what I learned over time, and of course, as they say, experience is the best teacher. So I've learned that when a system is fragile, it doesn't matter where you are, whether you're in DRC or in the US. We see it in many organizations where we work. If the system is fragile, it can create poverty. If you live in a rural area, we can see poverty here, even in the US. And when the system is fragmented, there's always a lack of trust in healthcare and public health. And we've seen that with the COVID-19 pandemic, how we've lost so much trust from the public with misinformation and disinformation, and also because our health system in any country, as we were learning about this new virus, we didn't really know how to make things work to keep the public abreast of all the new information, because we couldn't keep up with the new information that was coming up every day. And also with fragile system, it's easy to decide, I don't like this healthcare provider, let me move to the next one. Or you may receive a diagnosis and don't trust the healthcare provider and say, let me double check and have a second and third and fifth opinion. And then you're unable to even make an informed decision about your care because you have different information from multiple providers, because there's a lack of trust from our primary care provider. And with a fragile system, we also can see that if preventable harm is not stopped right at the beginning by having a stronger system, it always results in costly errors. We have increased infections for us who work in hospitals or clinics or long-term care. We have healthcare associated infections, and in the community, we have outbreaks that cause the economy to go down, and we just have issues from a system standpoint. And from my discussions with multiple leaders, and as I say in healthcare and public health, I noticed those were the same pattern. We all live in different contexts in different countries, but the root causes were always the same. The system is not set up for us to succeed. So what I've learned is that when there's system failure and we have fragile system, it brings long-term consequences that we may not see today, but we'll see in the future. And systems failure is a silent killer like hypertension. So when systems fail, it doesn't happen overnight. It usually happens with a little leak in our operations, or we forget to have a protocol for a specific process, or we have leaders have a list of priorities on their dashboard or their scorecards, and our department leaders have completely different priorities, and none of us come together to decide, okay, what are we going to focus on together as an organization to reach our mission and our vision. And what I see also in many organizations, we have outdated processes that were used in the 90s that don't apply in 2025. We have AI coming up, and a lot of organizations are still scared of AI, especially in healthcare. So they're not utilizing AI properly, or they don't even want to try AI. And things are either moving slowly or not moving at all. And as I was mentioning, when we have unclear priorities within our leadership teams, all our operations are siloed because everyone is running in different directions, focusing on different goals and different objectives. And that always causes, from what I've noticed, always causes an issue with staffing. Staff always get confused. They're not really sure who to listen to, what to follow, what's the priority, who's my boss, do I have 5 layers of bosses, what do I do here? So we hear a lot about this new term that came up, I believe 2, 3, 4 years ago, quiet quitting. We see people quiet quitting, or we have high turnover because the workforce is completely strained. So the misalignment between our leaders and our operational leaders is really tangible. So the early signals of a system failure is usually a suppressed innovation. We always have members of leadership teams who think about what can we do better? What's this new thing that's happening in the industry that we can adapt to our organization to systemize our processes a little better and optimize or redesign what we're already doing so we can be more effective. And we also see in those organizations there's resistance to change because it's already the culture. When something is new, what do we usually hear? We've always done it this way. And that's one of my least favorite sentences. We've always done it this way. I really don't like it because that shows that we either lack innovation or we just do not want to try innovative ideas. And another early signal of a system that's failing, all the improvement initiatives can be delayed. We may start very fired up and we start piloting, but we don't have systems in places to really help us move from the pilot phase to scaling to iteration so our processes can work in the long term. And of course, we also have siloed decision making because our leaders are not communicating correctly. And as I've mentioned, we have quiet quitting, turnover because the staff is always impacted by it and they all get burned out. So last year, I took it upon myself to do 11 polls on LinkedIn, and also got into roundtables with multiple leaders across America and Africa in public health and healthcare. So by looking at the data from 261 leaders in healthcare and public health, the themes that kept arising, we noticed that we have policies that don't align with practice. So what's done on the front line is not really what the policy says. And there's no shared vision between leadership, all the leadership teams, and also leadership and all of our frontline staff. And also, as I was mentioning, our improvement initiatives keep failing over time because we can't scale it. We're not really set up to make them be successful in the long term. And of course, there's this disconnect between leadership and the reality on the front line. And as I was mentioning, this was across continents. It's not just in Africa, it's in the US as well. And I've also heard from some leaders in Asia. So we see from these patterns, these themes, that the challenges are not really our technical knowledge. We know what we're supposed to do. We have the clinical training, we have the technical training, but it's actually our behaviors and our system that are not setting us up for success. So through all the learning from being a child to an adult to starting focusing on systems thinking, I had a Steve Jobs moment. I found out about this quote a few years ago. Since Steve Jobs, as we know, was an innovator. He's the creator of Apple, or was the leader of Apple. And one of his quotes, which is one of my favorite quotes, is the people who are crazy enough to think they can change the world are the ones who do. So for us, what does that mean? It means that we are here because we're crazy enough to think that we can change health systems, and we are the ones who will do it. So after that Steve Jobs moment, it became one of my missions to challenge the status quo. It is also part of who I am as a person. I like to be innovative. So that really helped me realize that I can help health systems wherever I have an influence. I can help make things better. So in healthcare innovation and challenging the status quo, as we use crazy from Steve Jobs quote, it's questioning the norm, especially in healthcare. It's totally against the culture of healthcare. Why are you questioning what we've been doing since 1992? Well, it's 2026 today, but some leaders don't want to move from 1992. And crazy also looks like challenging those old structures, but with intention, not going rogue or rebelling against the system, but really challenging, why do we do it this way? If we notice that it's not helping us, it's making our surgery turnover go slowly, it's making our outbreak investigations in the community not work, and we're still seeing transmission within the community. Why are we doing it the way we're doing it and not thinking about better ways to do it? As we always said, there's gotta be a better way to do this. So, and the last bullet point, I've put a strike through on it because, as I said, it's one of my least favorite things to hear. That's how we've always done it. And the fact that something has always been done a certain way doesn't mean that it's right. So as healthcare and public health leaders, that's something we need to keep in mind when we challenge the status quo, that we need to be intentional and really think about those root causes. So after my Steve Jobs moment, and I decided, okay, let me see how I can challenge the status quo. Excuse me. And I would say in my head, I didn't have in the back of my head, I'm challenging the status quo. It just translates in the way we act as innovators. So in this first case study, I found myself leading an initiative within a large healthcare organization. And I asked the leader of that organization if I could take the initiative and take that over. So our nurses, it was the entire organization had processes that were fragmented, and one of them was hand hygiene. We had nurse managers, instead of focusing on their leadership activities, were spending about 25 hours a week collecting hand hygiene data, while all of them had 2 to 3 or 5, I can't remember, assistants who could also help them. So we worked together and see where there were issues within the system and those operations. So we spread out those hand hygiene data collection within the team, from the nurse manager to those assistants. So each of them were only focusing on 2 hours of hand hygiene per week, which made the process even smoother for every one of them. And we eliminated all those inefficiencies. Their team started working well and cohesively, and it also improved their operations. So, and their team, their entire organization, because this was done in multiple departments in this one healthcare system, we started noticing that hand hygiene was only focused on the compliance at first, but then it became a behavioral training for the whole system. And the system was completely redesigned because everyone in the organization started seeing hand hygiene as a priority. So the nursing leaders, quality leaders, and infection prevention were able to applaud for themselves and say, oh yeah, we actually had a success with this project, because now all the priorities were clarified. Nurse managers were focusing on nurse management, and assistant nurse managers were supporting them as they were supposed to. And also now they had a shared vision, shared language, and shared priorities, and they saved about 600,000 within a year just from the nurse manager's salary. And later on, a few years later, they did obtain magnet status. And this is actually a similar project where the culture was shifted because hand hygiene became part of the overall goal of the organization. The doctors, nurses at the bedside now knew that their job was also making sure that they clean their hands, their colleagues clean their hands, their patient clean their hands, and that patients also remind them to clean their hands. So it became an overall culture for the whole organization because the hand hygiene system was redesigned. And when I started working with this organization, the hand hygiene program was only collecting hand hygiene data and reporting it to Leapfrog or to NHSN. But after we worked together, it became, we created a task force that was also educating on hand hygiene. So the entire culture shifted. And with time, they really started seeing those behaviors were sustained. Hand hygiene compliance was over 95% every month. And they started seeing the infection rates reducing by over 30%. And within 3 months, by reducing infection rates, this organization saved over $500,000. And the last one was working with leaders. In these organizations, I noticed that leaders wanted the same thing, but never communicated. And we see that every time, even with ourselves sometimes in our own lives, we have the same ideas, but we don't communicate or we don't communicate effectively. And we realize we making decisions by just reacting to what happens instead of just aligning from the get-go and deciding, okay, this is our shared vision and this is what we're trying to accomplish. So after working with those leaders, and this was in a healthcare facility, so I worked with leaders in the OR, in emergency room, in infection prevention. Once they were able to align together and also use infection prevention as part of the strategic goals in their business plan, they noticed that the culture changed. And also everyone started working towards the mission of the organization. So they started saving costs because staff were no longer quitting. They improved their operations, and of course, inefficiencies were also reduced. So for us today, what does that really mean? Why do we even care? So after learning all this information, would we think that when we see issues with burnout or compliance gap or turnover, is it really the individual issue, the individual failure? It actually shows us that there are some issues with our systems. It's not really Carole, he's tired or burned out because she's just lazy, or Dr. Ellis doesn't want to work, that's why she's quitting. That's not really at the individual level, it's at the system level. So we have to pay attention to those system signals. And also we have to think about and make it our leadership priority. If we're seeing a lot of our staff, especially the good ones, the ones who are dedicated, ethical, are the ones who are quitting or quiet quitting or burned out, then we know that there's a problem with our system. Where can we make improvements so they can feel a little bit better working here in a better culture? And we also see that compliance gap is not really a training problem. How many times do we train people, do we train our staff about the same things every year, the competencies, but we still see gaps? It's not because they haven't been trained, it's because there's something, the root cause is really with our systems and our processes. How have we set them up for them to be successful? So the reason the summit matters is because we're all coming here as leaders to break down those silos in the leadership and with our leaders at the front line. And we want to make sure we have a shared language and vision across all of our leadership goals, leadership roles, within our organizations. And also we'll have speakers share some tools and frameworks for leadership alignment that you can take and use in your organizations. And we want to really focus on making our decisions from a system level, not departmental level, because that only perpetuates silos and cause more issues in the future. And we'll also learn about some practical strategies for resilience and long-term success. And I can't wait for the keynote, the closing keynote tomorrow by Sean Frederick on resilience. That's one of my favorite. I can't wait to hear about, because we all need resilience with everything that's happening in the world right now. So Something I'd like for you to take today, there are 3 blind spots that we need to overcome to have greater alignment within our leaders and also with our leaders and operations leaders. So we want to overcome those technical barriers. Instead of thinking, okay, everything is technical, everything does not have to be technical. If we look from our system level, from our overall goal, the big picture, we'll see that the technical is not really what's causing issues, because we all have different technical trainings, but there's a way for us to have a shared vision and mission to make sure that things go forward. And we also need to overcome silos. That's one of the hardest things to break down, but that's why we need our leaders to sit down together from any and every department in our organizations to discuss together what's our main goal and how can we, within our different departments, contribute to this vision. And of course, purpose is really our overall vision. For us in healthcare and public health, our main clients, if I should use that word, our main client are our community and our patients. So our purpose is really to take care of them. But how do we do that? By looking at the big picture and making sure that our vision and our behavior and actions really lead to success in taking care of them. And of course, why are we here? Are we here because the speakers have a magic wand that can just fix your organizational problems tomorrow? I would say no, because none of us are perfect and none of us have all the solutions. And that's the reason why we come in here together. And is it because broken systems, as they say, times heal everything? Is it because if we just wait over time, our broken systems will get better? No, we all know from experience and history that they just get worse. And is it because by everything we'll talk about today, all the resources you receive, everything will change overnight? No, none of that is true. What is true is the fact that we're intentional and we're here today is really the first step and shows us that we can make a difference. And also, we're here because all of us have influence within our scope. It doesn't matter if we're a department leader or if we're the CEO, the COO, or the VP, we all have a certain level of influence where we can make a change. And we're also here because we believe that our systems can be better. And as I'm seeing everyone who could make it this morning, we're from all over the place. We're not all in Texas or in California. We're in different places. Some of us work both in America and in Africa and other continents. So we know that commonly we can improve everything because our systems are pretty fragmented and weaker at this time. And we're also here because we're willing to act instead of sitting back and spending our time complaining and criticizing and venting and ranting. We want to address the challenges and have a solution. So 3 actions I can already give you to take with you on Monday. And you can take a picture of the slide if you'd like. The first thing is we are leaders, so let's look at the forest, not the trees. If Carole is telling you that she wants to quit and she's being your best employee, the problem is not Carole. What is making Carole leave? If Dr. Ellis keeps calling in sick, and when she was working in your organization, she never missed work, but now she's calling in sick every Monday. What is the issue? It could be Dr. Ellis maybe being sick, but in general, it's something happening in the system. She doesn't want to be there on Monday. Maybe it's because there's a meeting where her manager is chewing up on her every day, or maybe there's an employee that she doesn't like to meet in a different department. And why is that? Let's ask ourselves, what is this telling me about the way our system is designed? And the second thing, we want to align across leadership. And when I say across leadership, just think about every department in your organization or any organization you work with. What departments are making these organizations? Those are the leaders you want to include. So that means every leader. And just as a leadership community, just pick one priority. Let's not tell ourselves, okay, we'll have 10, 20 priorities for 2026. Then we start scrambling because it's impossible to fix every priority at the same time. Let's just pick one and focus on this quarter. If we meet our goals, let's look at the next priority. If it doesn't work, let's keep focusing on this priority for the rest of the time and reevaluate every quarter or every month, however it would work for your organization. And once you pick this priority, just make sure it becomes part of your motto. In every meeting, every conversation, make sure this priority is communicated with all the leaders, even in your staff meetings, because once your staff is involved, they see that they're part of the greater mission and not just working at the bedside or doing outbreak investigations with no larger vision that they're contributing to. And some of them might just be there for the paycheck, but when they can feel that they're part of a greater vision, they become more motivated. And we can see that from studies in behavioral health as well, that once you include all your staff within your reaching your vision, they all become motivated. And the third thing I recommend to start on Monday, also try to identify one system challenge that you can redesign. And it could be the priority you've picked in number 2. Just that one system challenge, and set realistic goals. As we like using SMART goals, just use your SMART goal to see how you can redesign this one system challenge. Because resilience with your system, it really starts with small changes. As I explained in my case studies, some of them was just having all the leaders meet together and now they reach magnet status, or just talking to the nurse managers and see what was bothering them about hand hygiene. And now the organization saved 600,000. So it's really using the 80-20 rule, where 20% of your effort will bring 80% of the results. So now I'd like to end with your Steve Jobs moment. I had my own. So now your Steve Jobs moment is reminding yourself. You can also take a screenshot of this screen. So reminding yourself, I'm the one crazy enough to believe that healthcare and public health can be improved. And that's why I'm the one who will change it. Thank you.